Welcome to the CURES Show, where we explore the cutting edge of wellness. I'm Kara Sundlin, and talking about Lyme disease today. Like, how do you really know you have it? If you did have it, is it still causing you problems? Dr. Jennifer Stagg is the founder of Whole Health Wellness in Farmington. She also sits on the boards of many supplement companies and naturopathic doctor. So I'm excited to have you here to learn a little bit, because I think sometimes people think, oh, Lyme disease, it's over, or they don't even know they have it. So thank you for being here.
Oh yeah, absolutely. Yeah, thanks for having me.
Do you think, let's start with when we first get Lyme disease. Do a lot of times we just don't know, or do you usually know?
Yeah, so some people don't know that they've had it. A lot of people may have pulled off a tick and then they start having symptoms, kind of like the classic profile of Lyme disease, and they end up, pulling a tick off, watching and waiting, and then they start having flu-like symptoms like headache, fever, chill, stiff neck. Like, that's kind of like classic. Get treatment as soon as possible, and your outcome is likely going to be pretty good.
Okay, so, if you know right away.
Yeah, and you
do you usually have a bullseye, or that doesn't?
Well, so 70–80% of cases have the bullseye rash, but then some don't. So it can just, I think in Connecticut, a lot of doctors are pretty versed in Lyme disease in terms of symptoms and the time of year, and okay, this might be Lyme disease. But then there are all these missed cases because people can have symptoms and they never actually had a tick that they identified or pulled off. And then that can get confusing, or if they just kind of dismiss it and think they just have the flu or some sort of virus, then that can become more what we call disseminated Lyme disease, where it can get more advanced and result in joint problems like arthritis, and in really severe cases, Lyme can actually get into your central nervous system. You can get meningitis, you can have heart problems, so it's not something to really mess around with.
So it's springtime right now, and you're thinking that it's possible we'll even have more Lyme disease this year because the ticks had a very warm, wet winter, so we didn't kill as many of them with the snow or frost as we would normally.
Right, yeah, so that equates to a really bad tick season, and we're right in it now. I mean, just this morning I saw on a Facebook group, someone had taped their ankle, which I thought was interesting for outside. They were gardening and they, pulled their socks up over their pants, but they put almost like painter's tape around their ankle, and there were a ton of ticks stuck onto this tape. It's disgusting, but this is just a sign of how many ticks are out already.
So let's do the basics of, you might be thinking, oh, I'm not going in the deep woods, I don't need to worry. Is that true?
No. Definitely not. Obviously it's going to be more prominent or prevalent in more wooded areas, but you can also, depending on where you live, if your grass is a little higher, if you do have wooded areas near your home, you can definitely actually get Lyme disease in your backyard. Like my littlest one, when she was 4, she got a tick on her just playing on the playground at preschool.
Okay.
That's how she got
not in the
disease.
deep wooded area,
no,
right? Yeah. And you were lucky because you knew. But so let's just say, what do you wish people knew? What do you want them to do if they even think they might have Lyme disease? Yeah,
so definitely go to your doctor right away and ask to be tested for Lyme disease, but also advocate to be tested for other tick-borne illnesses. So we hear Lyme, Lyme, Lyme. That's one specific type of bacteria, but ticks in Connecticut can carry a number of different types of bacteria. Bacteria like Anaplasma, Babesia, these are all big words, Ehrlichia, but even, there were a few cases last year of Powassan virus, which is really uncommon, but we're having a couple of cases a year, and that can be spread through ticks as well, and a woman died last year from it.
Right. Oh,
yeah.
Okay.
Yeah.
So we worry a lot about our kids. Does it present differently with kids? What if we didn't see the tick?
Yeah. So you definitely want to be doing tick checks, in the summer, routinely, getting, behind the knees, looking at the back of the hairline, behind their ear. So you really want to, and I've pulled ticks off my kids, doing tick checks. Not a lot over the years, but I have pulled ticks off a couple of times.
Okay.
And you do want to get that tick right at, you want to pull it off close to the skin. So I brought this
we have a tick removal kit right here.
I don't know.
Where do you get those?
So you can buy these on Amazon. This is just one example. This particular one has a a little, it looks like a little divided area, and you just sort of slide it in close to the skin and just pull straight up. Because you don't want to.
You don't want the venom, or if that's the word, to be in there.
Yes, because that tick is kind of sucking on your blood.
Gross.
And getting engorged.
Gross.
So you want to really try to pull it off and get all those pieces off, and then clean that area really well. And then with your kids, like some adults will take a short course of antibiotics right away. Like this, a lot of primary care doctors might give a few days worth of antibiotics just as like prophylactic. But you can just watch and wait, which is what I did in the case of my daughter. And I waited, and then all of a sudden she spiked a fever. And then you would definitely want to treat. And at that point, testing is not really reliable. You won't even see a positive test. So you do want to go off of symptoms if you have identified a tick. If you have symptoms and you've never identified a tick, that's where it gets really difficult, right? Because you could get tested and the test might not be positive right away if that tick was pulled off, less than 3 weeks ago.
So I'm wondering, it was maybe a couple of months ago, my daughter was sick and she had a really bad sore throat and felt flu-like. And, we went to the pediatrician and they ruled out it was not flu, and it was not COVID, and it was not strep. So we're like, okay, it's just a virus. Like, in a situation like that, should you be asking, like, oh, can we test them for Lyme too?
Yeah, probably not that case, because you're not usually going to have like sore throat or runny nose, those sort of like respiratory type symptoms. It's going to be more like flu-like symptoms in the absence of like throat, nasal symptoms. So more just like fever, chills, body aches, stiff neck, headaches, those sorts of symptoms. Maybe nausea and vomiting even in some cases. That's less common, but that can happen as well.
Okay. So what do we do about it, prevention? And then I want to get to, there's also, please stay tuned, because there's so many of folks who have an old Lyme disease and think, okay, I'm stuck with these symptoms. And I know you've helped a lot of people live, they don't have symptoms anymore, so we want to get to that. But what about, this is where I wonder, because in the naturopathic world, we don't want to do too many hormone disruptors, things like that, and yet one way that we would be really careful is have them come in and just spray the yard and kill all the ticks and use DEET. Like, so what do you think?
Yeah, so there's, you can kind of go halfway, and there are good bug repellents that are natural or less harsh than DEET. So there's oil of lemon eucalyptus, which is somewhat synthetic, but it's based on a natural product. And so, like, I get my yard sprayed, but it's a natural company, a local natural company. And then they're using things like garlic and thyme oil, and there are commercial companies that do this, so you don't have to go out and mix all this stuff up on your own.
So you can ask, not even just for ticks, but for weeds and things.
And so that would cover like mosquitoes and ticks.
Okay.
And then in terms, like your lawn treatments, you can also get natural lawn treatments. There are a number of companies that do that as well. So that's, you can do all of that. That's easy to do, and you can avoid those really harsh synthetic chemicals.
If you're going to use the DEET, which we talked about earlier, that is sort of what the CDC tells us to do when we're going around, especially in wooded areas. Yeah. What's your tip about if you decide I'm going to use the real stuff? Yeah,
so I would just make sure I'm not spraying it directly on my skin. And so if you're going out hiking in the woods in Connecticut, you really should wear long pants, thin pants, and tuck your socks in like over your pants, and then just spray mostly your lower body for ticks. Right?
Do you really feel it when you're bitten, or is it possible a lot of times you just have no idea?
Yeah, when you're bitten, you don't necessarily feel it right away. It can be attached, and you are not feeling anything at all.
Okay.
Yeah.
But if we get it and we see it, that's why you're saying do the tick checks. If we remove it pretty quickly.
It can get irritated as it's staying on there and it's feeding on you.
Yeah.
It can become quite irritating.
Little vampire.
Yeah. And then some people will have like a local skin reaction that is not like the classic bullseye rash. It's just like a local reaction to what's going on, and they'll definitely feel that.
If we manage to find the tick, what do we do? Should we get it tested?
Yeah, you can definitely get it tested. So you just take it to the local health department, put it in a little like container or bag, and I've done that before and brought it to the health department, and then they send it to the Connecticut Agricultural Center in New Haven, and then they will check it to make sure it doesn't, to check it to see if it contains any harmful bacteria, and then you'll get an email back from them.
Okay, so just to summarize where we are right now, you should be an advocate of not only getting tested for Lyme disease, but other tick-borne illnesses illnesses if you think you were exposed to a tick and you're feeling like these symptoms.
Yeah, yeah.
And regardless of if you can find the tick or not, just go by your symptoms when the tests say.
Yes.
This is where maybe your traditional medicine and what you do with more precision medicine or naturopathic medicine is going to differ a little bit, in that often you are really finding latent Lyme cases that people didn't know about.
Yeah, so you can definitely find that where you have someone who's been dealing with some sort of like musculoskeletal arthritis fatigue that's been ongoing for a number of years, and then when we do this testing, we can find infections like anaplasma that they will say like, oh well, I've never been treated for Lyme disease or anything, and they have antibodies against all these different types of bacteria. I found them multiple infections in some patients, and then they, could do a short course of antibiotics, and it doesn't always turn it around. Some people, it can make a big difference for them, and it's indicated if it really looks like an acute, like persistent infection. But once you've went so long with not being treated and then get treated years later, you often don't feel better right away on like a 10, 14-day course of antibiotics. And then there's this other kind of, they're both theories about what's happening. Is it, a persistent infection, you still have bacteria in your system, or in a lot of cases, what I see is that it's more of almost an immune, what we call like an immune imbalance or autoimmune response. And so that person has been affected by that infection. They may not have any bacteria in their body anymore, but their immune system is reacting like they still have an infection.
Okay,
Yeah.
and so that's when, what would symptoms like that look like?
Yeah, so that typically looks like fatigue, headaches, nerve pain, joint pain. Those are the common symptoms that we'll see with those types of cases.
Yeah, I mean, I have a dear friend who mentioned, oh yeah, I just am so tired all the time. I have to take naps in the afternoon, but I had Lyme disease. And kind of resigned to the fact that this is how you're going to have to feel.
Yeah.
You don't have to stay that way?
No.
What do you do?
Yeah, we see a lot of patients in our practice, obviously because we're in Connecticut, and there's such a high incidence of Lyme disease here and these co-infections. So we use natural products. So we're using mostly like herbal supplements and some vitamins to help kind of rebalance the immune system, similar to kind of the concept that we do when a patient has autoimmune disease, that we're trying to turn off that arm of the immune system that's hyper-reacting.
Okay.
And that can take a bit of time, right? They haven't gotten there overnight. So it's a course of treatment, but a lot of times, I always have someone like that as an active patient in our practice, but I'm just
And they've been told often they have other things like arthritis or this.
you've just got
they might be on
chronic
biologic
fatigue.
drugs, or
Right.
you've got chronic fatigue.
Yeah.
So the difference, if people aren't aware, a naturopathic doctor, you really want to get to the root and find out why are you feeling this way.
Absolutely.
And so what types of things? I know I was able at your office to interview a woman who'd been in pain for 2 years and on tough biologic drugs and thought she had lupus and arthritis and all these things, and you found an old Lyme infection.
Yeah.
And then she claimed it was just like a miracle. She didn't know what you
Right.
did, but
Yeah.
she doesn't have any pain anymore.
Right.
And so talk about some of the treatments that you're using to help people.
Yeah, so we use a lot of combinations of herbal supplements. So there's a common product that we use that will contain a number of different botanicals. And those botanicals not only can have an antimicrobial effect, so if there was some latent infection, a persistent infection, it can act as a direct antibiotic, like a natural antibiotic.
Like an oregano type thing?
Yeah, so oregano, cat's claw is another one. There's a lot of different herbs and we usually use these herbs in synergy, and there are a lot of different formulations, so I don't want to just like pin a label.
Right, we're
on
not
one
saying
of
just
these
necessarily go to the Whole
particular-
Foods store. Not
Right.
that, it's great to have vitamins and all, but
Yeah.
you're using them in pretty high doses and in therapeutic ways.
Right, very specific, and then that can help to kind of rebalance the immune system. And we'll often use products that also contain curcumin, which is the more active ingredient in turmeric, which can help to kind of switch that immune system back to regular function, where now you're not reacting it almost like against yourself or like you have a chronic infection. So it is often a combination of products that we use. Sometimes we're using products that break up what's called a biofilm. So if it is a bacteria can grow in your body in what's called a biofilm. And so enzymes tend to break up a biofilm. And just so people understand what a biofilm looks like, it's sort of like if you've had a jar of liquid something in your fridge and something's went bad and there's like this
That
layer
thing
on top. Yeah, that's
like
a
in your
biofilm.
body?
Yeah, and
Oh,
that's
lovely.
how bacteria can grow
Okay.
in your body. And so when you use enzymes to break up the biofilm, then the botanicals can actually have this direct antimicrobial effect. So it can get a little complicated.
Yeah.
right?
Well, different than. But what about, let's say, it's spring right now, and you're even concerned. You want people to do their tick checks. Anything that we should be doing as far as diet or supplements, even just because it's tick season, like to
Yeah.
kind of make sure we don't fall victim as
Right.
much?
Well,
is it like flu season? We take a lot. Yeah.
Well, yeah, kind of, I would say. And I do have patients in my practice who have had multiple rounds with Lyme disease and will get really sick from it.
Yeah.
And so some of those patients, I do have patients, there was a study that came out of, there are natural products, I'll get to that in a second, but there was a study that came out of Stanford a couple of years back, and it was on the Claritin, basically.
Oh.
And they showed that Claritin was able to starve the bacteria that causes Lyme disease. And so I have a couple of patients that I have them take Claritin, and they also have allergies, so it comes
It helps
in
both
handy.
ways, yeah.
But they're taking Claritin during Lyme season so that if they were to get bitten by a tick, that maybe they'd have a little bit more resilience against it.
So if someone's taking the over-the-counter like Zyrtec instead, should they just switch to Claritin?
I have had patients that I've had them switch over to Claritin.
Because it doesn't work with Zyrtec, just the Claritin.
Yeah, because the study was, it could, but the study was on Claritin specifically.
Okay, and that means just generally if you suffer from allergies or if you want to start doing it for ticks, you would start taking it now because it needs to build up in your system?
Yeah, well, I think, I would just start taking it about now, I think. And this is obviously when
we have all the pollen and everything.
Too,
yeah.
so.
Yeah, if you haven't already.
Yeah, so it's a handy thing to take.
Okay, and then back to as far as supplements you might want to do.
Yeah, so we just think of like whenever you're fighting any, like needing to fight or be prepared to fight an infection, making sure your vitamin D status is in good check. So making sure you're on an appropriate dose of vitamin D. Obviously in the summer, we make more vitamin D if we're actually outside with our skin exposed and not covered in sunscreen.
Yeah.
So some people think like, oh, I'm good, I don't need to take it during the summer, but a lot of us do because we're not out enough, or when you do go out, you're covered in sunscreen and can't make that much vitamin D. Probiotics are also a really good immune supportive supplement to take, so really good probiotics will help kind of boost your immune system too.
Okay, so and vitamin D, always good, even if you're with your regular doc. A lot of people are getting it tested.
Yeah.
The levels that you like to see are a little different, right? What do you see as optimal?
Yeah, so I like to see people around like 60 to 80 range.
Okay.
And most of the time, I mean, every time I test a patient who has not been taking vitamin D, it's definitely like deficient, which would be under 30, and we do see it even low, way lower. Like I had a patient who was 4. Like that's probably my record low.
Wow.
Yeah.
And kids too, they should take vitamin D.
Yeah, for sure.
So
lower doses, obviously.
Lower doses. So I noticed even when I was on my prenatal vitamins and I was doing all these stories with vitamin D, I thought, well, I'm taking prenatals, but I was still
deficient.
It was 35. It wasn't horrible, but that's on prenatal vitamins, and like optimal in your world would be 50. So they did say you should start taking it. I do notice a difference, especially in the winter. You're a little less moody, I think.
That's true.
So I guess give the kids like, what, 2,000 units, 1,000 units?
Yeah, it depends on how old they are. So most, and especially like if they're being breastfed, they definitely need to be on a vitamin D supplement, and pediatricians are great about recommending vitamin D for those kids or babies. And then, probably a lot of times around 1,000 is often what we recommend. And then as the kids are getting older, then they need higher doses often. Okay. But you can also
for adults
test. For adults, like definitely 2,000, but a lot of people around here, a lot of my patients end up needing to take 5,000. And I even have some patients that take 10,000, but I wouldn't recommend that without being tested.
Knowing.
Yeah.
But a good I want to start taking it. I'm listening to CURES, and I'm going to go to the drugstore. You're going to get, start out with like 2,000.
Yeah, 2,000 is a pretty good standard dose.
Okay, and the bottom line is people think, oh, I drink milk, or I drink this. It's not a lot in our food, right?
And there's not.
Start eating like cans and cans of sardines, maybe. Gross. So basically the tests that you want to ask for, just to review for folks, if you think you might have Lyme disease or you just want to bug your primary care person. Of course, you
Yeah.
could go and talk to Jennifer Stagg. Dr. Jennifer Stagg is at Whole Health, which is in Farmington. I know you treat people virtually also if you're not living in Connecticut. But you would say, okay, I think I might have had, I don't know, but please test me for all tick-borne illnesses.
Right, exactly. So you just want to be clear that you're not just only getting tested for Lyme disease, and sometimes you're just tested with what's called a Lyme screen, and that really shows up more so in the cases of really acute infection. So if it's been a while, you really should push to have a Lyme immunoblot, and that will show a number of bands of IgG and IgM antibodies.
Okay.
And that's where we often find some of these older cases that they have, like, you know, all these bands light up in some of these cases.
And then what's that called again that you can ask?
Immunoblot, a Lyme immunoblot.
And can you get those at
You can get it
Quest?
at Quest, yep.
Okay, it's
a
just
routine
that it's
test at
possible
Quest.
that your standard doc may not be asking
Right,
for
they
it.
might just order a Lyme screen. So you would want to ask for an immunoblot, and then you also want to ask for those other tick-borne illnesses. So anaplasma, Babesia, and Ehrlichia are the main ones that you would want to ask that are tick-borne.
Does that mean you would have a Lyme disease if one of those tested positive, or you just have a different tick-borne?
Yeah, so then you have what's called a tick-borne illness. Two of those do respond to the same antibiotic that Lyme disease would treat, but one of them the Babesia bacteria requires a different set of medications. It's actually two different medications.
So it's all
that you have to take
bacterial
for it.
then, it's not viral?
Yeah, except for that Powassan virus, which is very, very rare. And a lot of people, there are probably more cases of Powassan, but people will just like clear it and there's no treatment for it either. It's just supportive measures. So just like any virus, right? It's all about resilience.
Getting your sleep,
COVID,
taking good
like
care of
everything,
yourself.
right?
Yeah, we
Like,
all learned a lot about
so
viruses.
it's the same when it comes to Powassan, and the cases where people get really severe illness, they're usually immunocompromised.
So you might want to think about asking to get your yard sprayed, and that's great to know that if you're worried about, you know, in the past years I kind of quit all the chemicals, learning about all the endocrine disruptors, and I know, but so it's great to know that there are natural options that you think that'll work.
Yeah.
And just being really careful to check and make sure that we have what we need. The positive note, I guess, when I read the statistic, I was like, oh my gosh. So as high as 40% of the ticks carry an illness, but about 1 to 3% of tick bites actually lead to an infection. So we're not going to always get it every time a tick bites us.
Exactly, that's right. That's why you don't necessarily want to rush out and take antibiotics every time you pull a tick off, right? Like that's probably not good practice. But if you are someone who has had Lyme disease before and had a tough time with it, those cases I would say, yeah, probably do prophylactic, like a little bit of antibiotic once you pull that tick off.
Okay.
In those cases.
Or what if you haven't been treated for antibiotics in a long time and you just want to be safe and it's not like, okay, I haven't done this for a while. All right, I know I just got bit by a tick. And your doctor says, I want to put you on antibiotics. You say, okay, I'll do it this time.
Yeah, and it's not going to be the same course that is if you had full-blown Lyme disease, because that's like a 14-day course. And when they do prophylactic, it's just like a couple of days worth.
So we definitely suffer from it here in Connecticut. That's where it was discovered, I guess in 1975?
Yeah, 1975.
Oh my gosh. So
Lyme, Connecticut, that's where we get Lyme disease.
So now it's all over the country and in other parts of the world as well.
Yeah, it is in Europe. I know Scott asked. It is in Europe and in like temperate parts of Asia as well.
Okay.
Yeah.
I think a lot of people just think we fear it, and as a mom, you're looking for a bullseye, which we may not always see.
Right, yeah.
And as an adult, you're just thinking, I don't know, I didn't even know I had a tick, and I didn't go into some woods, and I didn't hike, but apparently just being in our yard is enough.
Yeah, and a lot of cases, people, even in the winter, I know, countless cases of people who just like their knee got really swollen all of a sudden and they hadn't injured it, and then they get tested for Lyme disease and they have Lyme disease. And that can happen in the winter when we have these mild years. And like I've seen patients who've gotten diagnosed with Lyme disease like in February, and knee is all blown up and it's Lyme disease, and then they take antibiotics and their knee is better.
Oh my goodness.
So watch out for that too. That's another presentation.
Oh my goodness. I want to just, before we go on to this conversation, I want to check in with Alex to see about how much time we have as I know we're coming to the close here, but okay. So do men or women suffer more from Lyme disease?
I haven't seen any statistics on that of like one over the other. I would say women tend to seek health care more than men, so often we see more females coming into practice, like trying to find answers and solutions.
Do they get more
for it.
painful swelling type things than men, or men get the same thing?
Yeah, pretty much the same. I haven't seen any data showing that it's a different presentation, male versus female.
Okay, all right.
Like, man,
How long does it take to get these test results back? Like, are they usually pretty easily to be done and pretty reliable?
Yeah, some of them can take a little while to come back. So when you're doing the full panel of tick-borne illness, it can be up to a week before you get everything back.
I mean, most people I think would have a practitioner, but I know there are people who are just now going on and ordering their own tests on Quest.
Yeah.
So again, you want them to do not just the Lyme screen, but the Lyme blot.
Yeah, so the Lyme immunoblot.
Immunoblot. Okay.
But yeah.
And then asking your doctor for all the tick-borne. So things that we want to do is just keep healthy, make sure that you've got your vitamin D up to speed. I know you're a big recommender of also a multivitamin, if people are wondering, a high-quality one.
Yeah, so really good multivitamin, and ideally a vitamin that also has antioxidants, like plant chemical antioxidants, so not just like vitamin E.
Yeah.
A lot of blends now will have the superfood extracts blended into the multivitamin, and then that's really important for cellular health too, and for your resilience.
Right. There's a local company here in Connecticut we've talked about. I'm not saying it tastes great, but it's a green powder called Green Vibrance.
Yeah, that's great.
That's great. And then you like Metagenics phytonutrients, right?
Phyto Multi. That
Phyto
they have
Multi.
is a really good one, and they blend in the plant-based antioxidants.
And then you don't have to worry about putting it into a drink.
Right. Yeah. You just take it in a tablet and not have to taste it.
Yeah. So if people have been feeling sick for the last, year, 2 years, 6 months, or however long, this is in most cases. Do you see that the woman that I met through you, she feels totally normal again?
Right.
Once going on some of these natural protocols with a doctor like yourself, do most people actually get to 100% cure
well, I mean,
or 100%
I would
feeling?
say not everyone. Definitely not everyone. We can see a lot of progress, and we definitely have many cases that are turned completely around, like this woman that we interviewed a while back. But when people are so ill for so long, sometimes it's taking a while to turn things around, and it can also even get like more complicated because now they've had often like other insults. So now they've been challenged with other immune challenges, like maybe they've now, like in our era, they've gotten COVID now, and they've had a hard time with COVID because they were already almost like immunocompromised from a persistent infection.
So in fact, since we've had so much COVID and we've had people even, I know here, getting it multiple times, do you think this tick season represents more of a danger because of what we've been dealing with COVID and other things the last couple of years?
Yeah, potentially. I mean, we can't say that for sure, but it's definitely the whole story that we continue to push of making sure people are thinking about their resilience, right? And that means that they're better able to fight any sort of challenge, like whether it's bacteria or virus. It comes down to lifestyle, a lot of it. So nutrient deficiencies, but also how you eat and managing stress, all of that affects your immunity.
So we can follow you on Instagram. It's at Dr. Stagg.
Instagram is at Jen Stagg.
At Jen Stagg. With one N. And then also Whole Health LLC in Farmington, Connecticut, but you also do a lot of practice virtually. So if people are listening to this, you don't necessarily have to go to the office because so much of this is going to be running the tests and then getting information.
We can definitely do virtual visits there, use telehealth.
All right, so make sure that you share this with someone you love and listen to it as we're going into tick season. Pretty gross. But we want to stay safe. As far as I know, knock on wood, I haven't had Lyme disease. Now I know enough. I hope I never get it. But all right, thank you, Dr. Jennifer Stagg from Whole Health. We appreciate you being here.
Thanks for having me.
And you can follow me on social media at Cara Sundlin. I do like to share this content there. Have a great day, everyone, and be well.